Hi, I'm Dr. Gary Kronen, a board-certified hand surgeon with Mid-America Hand to Shoulder Clinic. Today I'll be speaking to you about carpal tunnel syndrome. Carpal tunnel syndrome is one of the most common conditions which we see in our hand and upper extremity practice. In fact, carpal tunnel syndrome is the most common compressive neuropathy in the upper extremity. By compressive neuropathy, we mean that there is a nerve injury, and this is caused by pressure on the nerve. The nerve injury can be caused acutely by an injury, such as trauma from a distal radius fracture, or a crush injury which may occur at work. Most conditions of carpal tunnel syndrome develop insidiously over time. That is, they are more chronic in nature. The hallmark of carpal tunnel syndrome is numbness and tingling or sleepiness of the fingers in the hand. To the physician, numbness, tingling, as well as sleepiness represent the same thing. What occurs is that as the nerve travels from the wrist to the hand, pressure on the nerve causes the nerve to not function properly, and the individual then will experience numbness and tingling. Some people experience numbness and tingling radiating up the forearm into the shoulder, which is not uncommon. Pain may also be a symptom of carpal tunnel syndrome. However, pain without numbness and tingling typically represents another condition in the hand and wrist. Some patients with long-standing carpal tunnel syndrome will experience clumsiness or weakness of the hand. This usually indicates advanced carpal tunnel syndrome, which has affected its ability to control your thumb. It's very important when seeing your hand surgeon that they do a thorough history and physical examination. This will consist of evaluating the median nerve. Several of the tests which we use are tapping of the nerve to see if you experience electric shocks in the fingers. This is called a Tunnel. Another test which we use is direct pressure on the median nerve, which is called a median nerve compression test. For those patients who have intermittent symptoms of carpal tunnel syndrome, typically a night splint is prescribed, which helps prevent flexion of the wrist so that you do not experience the symptoms of numbness and tingling or awaken at night. If this does not eliminate your symptoms after a period of 3 to 4 weeks, then typically an electrodiagnostic test or an EMG is ordered to evaluate the status of the nerve. After the nerve test is completed, you will typically meet back with your physician to discuss the results of the test and then to determine whether further conservative therapy is warranted or surgery to relieve pressure on the nerve would be indicated at that time. Most carpal tunnel operations can be done as an outpatient procedure, and in 95% or more of cases can be done under local anesthesia. One of the biggest things that we see is patients avoiding carpal tunnel surgery because they are concerned about having to have some type of anesthesia for surgery. The fact of the matter is most of these can be done under local anesthesia. Post-operatively, a small dressing is put on and you are encouraged to use your hand as normally as tolerated. You typically will see your physician back in the office in anywhere from 7 to 14 days. Occupational therapy may be required in those patients who have significant hand swelling or stiffness. The results of carpal tunnel syndrome are quite good. The recurrence rate is only approximately 5%, and this typically occurs in situations where the patient has an incomplete release of the nerve has become trapped in scar tissue later on, or the patient has an underlying condition such as rheumatoid arthritis where significant swelling has developed in the wrist, leading to further compression of the nerve. For more information on carpal tunnel syndrome and to see more educational videos, please go to handtoshoulderclinic.com.